Okay, today I'm going to teach a little bit about trisomy 21, which is Down syndrome. This is the most common type occurring when a pair of 21st chromosome fails to separate during cell division, resulting in an egg or sperm cell with 3 copies of chromosome 21 instead of the usual 2. Down syndrome is a genetic condition, meaning it is caused by an abnormality in chromosomes. It is not usually passed down in families, but it occurs during a random error in cell division. Down syndrome is the most frequently occurring chromosomal disorder and the leading cause of intellectual and developmental delay in the United States and in the world. The chance of having a baby with Down syndrome increases with the mother's age. However, about half of babies born with Down syndrome are born to mothers under 35 years old simply because more young women are having babies. Down syndrome has nothing to do with race, nationality, socioeconomic status, religion, or anything the mother or father did during the pregnancy. There's no cure for Down syndrome at all. Down syndrome is a genetic condition caused by an extra copy of chromosome 21, and it is present from conception. There are many characteristics and health issues along with this. Physical features. Some of them are distinctive facial features, slanted eyes, small nose, and a large tongue. Short stature and hypotonia, which is low muscle tone. That's very common. There's some developmental delays as well. Individuals with Down syndrome may experience intellectual disability, learning difficulties, and delays in speech and motor skills. People with Down syndrome age faster than other people. Their total brain volume begins to decrease as early as their 20s. Some very common health issues, more common in people with Down syndrome, but some are less common. Around half of the children with Down syndrome will have heart issues, although fewer than 1 in 5 of those may actually need surgery. They're more likely to have muscle tone and digestion issues and may have reduced hearing or vision. However, they're less likely to develop some cancers and types of heart disease. Down syndrome is not a life-limiting condition. People with the condition can lead active, healthy, and fairly independent lives into their 60s, 70s, and beyond. And last but not least, I want to talk about the types of prenatal screenings that are available to screen for Down syndrome. Prenatal testing for Down syndrome involves both screening and diagnostic tests. Some of the screening tests, most common is non-invasive prenatal testing, shortened, known for NIPT, a blood test that analyzes fetal DNA in the mother's blood to assess the risk of Down syndrome and other chromosomal abnormalities. NIPT is highly accurate and can be done as early as 10 weeks of pregnancy. There's a first trimester test also. It combines a blood test measuring specific hormones and an ultrasound measurement of the nuchal translucency fluid in the back of the fetal neck. This test is typically performed between 11 and 13 weeks of pregnancy. There's a quadruple screen, second trimester, a blood test performed around 15 to 20 weeks of pregnancy that measures levels of AFP, HCG, unconjugated estriol, and inhibin A. There's an NT scan also. It's an ultrasound performed around 11 to 14 weeks that measures the amount of fluid in the back of the neck. The diagnostic tests are known as amniocentesis, a procedure where a needle is used to collect amniotic fluid containing fetal cells for genetic testing. Amniocentesis is usually performed after 15 weeks of pregnancy. There's a chorionic villus sampling, shortened as CVS, a procedure where a sample of tissue from the placenta is collected for genetic testing. This can be done earlier in pregnancy than amniocentesis, usually between 10 and 13 weeks of pregnancy. There's one called chordocentesis, or PUBS, a procedure where a needle is used to collect a sample of fetal blood from the umbilical cord. And some important considerations for these would be screening tests provide probabilities, not definitive diagnoses. Diagnostic tests provide definitive answers, but carry a small risk of complications such as miscarriage. And the choice of test is a personal decision based on individual circumstances, not risk factors and preferences.